Hey everyone, and welcome to another edition of All Teed Up. I'm Dr. Tim, and today we're going to talk about the importance of movement screening, okay, and why we do it. And there's two reasons why. A, it's going to give me information about stability patterns, but also altered motion. Now, I had a patient the other day ask me, well, why don't you just isolate and test a particular muscle? And I use the tight hip flexor that we discussed with the lower cross syndrome a couple of videos ago to help illustrate that. If I were to just test the hip flexors out, and yes, I found out that they were tight, that's really giving me no information about potentially that weak glute that also exists as a result of that reciprocal inhibition. Now that's where a movement screen will give me a plethora of information in terms of what we really need to focus our treatment on and what we need to work on to right the ship per se. Now, why do these movement patterns change? I call it the four terrible T's. Trauma, whether it be posture, whether it be an accident, we could have thoughts, stress, anxiety play an awful role in our daily living today, and that can alter it. Toxins, what we eat, what we drink, the air we breathe in, and the last thing is techniques, okay? Whether it be a poor motor learned skill or maybe it's just a muscular imbalance.